Good morning, good afternoon, everyone. Welcome you to this session that has been co-developed with CAIRE and CAIRE on building community partnerships in immunization research. So next slide, please. Oh, I can't see the slides advancing on my screen. I don't know whether it's just my screen or... Okay, thanks, perfect. So I'm going to moderate the session today for the next hour or so. I'm a pediatric infectious disease physician scientist based at BC Children's Hospital and the University of British Columbia. Next slide, please. So I want to just start with a land acknowledgement, and I want to ask you first to take a moment to reflect on the land in which you live, work, and play. I just would like to further acknowledge that the CAIRE Coordinating Centre based here in Vancouver operates on the traditional, ancestral and unceded territory of the Coast Salish peoples, including the Musqueam, Squamish and Tsleil-Waututh nations, and that this acknowledgement, gratitude and respect extends to all of the First Nations communities on whose traditional territories CARE activities take place, as well as to the virtual offices of the members of CAIRE's team. Thank you. Next slide, please. So I'll talk about CARE shortly. I just also wanted to say a couple of words about CAN-COVID, which is a network of active researchers, academics, patient partners, decision makers, and industry partners dedicated to an evidence-informed response to the COVID-19 pandemic. And you can find out more about CAN-COVID at the website cancovid.ca. CAIRE is the Canadian Association for Immunization Research, Evaluation and Education, which is a professional organization with a mission to enhance immunization research and program evaluation through education and collaboration amongst multidisciplinary experts in Canada and internationally. Next slide, please. And membership to CAIRE gives you access to a network of professionals supporting vaccine research and immunization program development, evaluation and training, opportunities for funding and awards, support co-developing workshops, panels, and other educational opportunities, as well as networking and educational events. We also have members-only web resources, and you can find more information about this at our website, which is caire.ca. Thanks. So before introducing the first speaker, just to give you an outline of the program today. So we have three excellent speakers, so I'm really excited to hear from them. So what we'll do, each of them will give their brief talks. We'll then have a panel discussion session. So we have some questions that we've sort of predetermined, and then it'll be totally open to Q&A from you as well. And hopefully we'll have a really interactive discussion, interactive session. I just do want to encourage people to put your questions in the Q&A. We will do them at the end once we've had all the speakers and the initial facilitated discussion, but please do put them in there to try and help that process go smoothly. And we've already got one question in there, so please do continue as the speakers are talking. So I want to introduce the next speaker now, is Jacky Leung, who's the Program Director of Wellness and Active Communities at Success, and he'll be joined shortly by Dr. Wendy Pringle, and they'll be discussing qualitative immunization research with communities and lessons from the COVID-19 community response study. So thank you, Jacky, for joining us today, and I'll hand it over to you.
Thank you. Thank you very much for having me. So I'm from Success. We're a social service organization in BC, and we have a lot of different services that target different clients. We have settlement services, employment services, and health education, housing, residential care, etc. In particular, what I do is I work with seniors, and I also work a lot on health education and providing culturally appropriate services that can support people who don't speak English at home. For example, we have a large outreach with Chinese speakers in the Lower Mainland in BC. We have annual health fair in Chinese that we've been doing since 1991. We've had various education projects such as on Hep B, Hep C, on diabetes, on prenatal classes, since the pandemic, at the start of 2021, when we had the vaccines, we did a lot of multilingual webinars on the COVID vaccines. And I think, and then we had an opportunity to work with Wendy to be a community partner for her study. And partially because of this work and also with the vaccine, with promoting the vaccine early on, we currently are delivering a health education project on COVID vaccines to immigrants in the Lower Mainland. And I think that's what we're going to talk about. Thank you.
Thank you, Jacky. And yes, we'll certainly have time to explore more of those issues later on in the discussion. So next, I'm going to hand over to Dr. Wendy Pringle, who's a postdoctoral research fellow at the Vaccine Evaluation Centre at the BC Children's Hospital Research Institute. So Dr. Pringle, over to you.
Thank you so much, Dr. Sadarangani. I don't have any disclosures to share, but I think on the next slide, yes, thank you. So I'll just jump in and talk a little bit about the project that we worked on with success. So this was a study that I worked on with Dr. Julie Benninger here at the Vaccine Evaluation Center. We started off in early 2021. This was part of the sort of rapid round of COVID research that took off in the earlier months of the pandemic. And our focus here in BC was really on Asian populations. So that includes East and South Asian populations. And we were really aiming to understand how these communities were impacted by the pandemic in a holistic sense. In part, given the disproportionate stigma that Asian communities were facing throughout the pandemic and continue to face, and aimed really at understanding how public health can better engage communities in delivering equitable information and services. So this was a qualitative project focused that we did via interviews. These were with we called community members, so regular folks, as well as social services professionals who were really on the front line delivering care and services. We also talked to healthcare providers who work with these communities and community advocates. So if you're not familiar with BC's diversity, we have a lot of Chinese speakers as well as Punjabi speakers in the South Asian community and the Sikh community. So that sort of became our focus, to understand how living the immigrant experience and potentially having barriers to healthcare in regular times would impact your experience of getting care and getting public health recommendations during the pandemic. And so, of course, at the heart of that was also the question of COVID vaccine. We were asking some of these bigger questions, but we also wanted to hear about, what it means to navigate the system of registering for a vaccine, actually making it to the clinic, having a healthcare provider to answer your questions. As Sarai mentioned, we know that the biggest factor in making your decision to get a vaccine is being able to have that conversation with your most trusted healthcare provider. Of course, if you face barriers in getting that care, or if you have a language barrier, the situation is all that much more complex. So we knew we wanted to partner with an organization who would help us better reach and understand this demographic, and also to help us weigh in on our plans for doing research, help us refine our plans a little bit for questions that we would ask participants, how best to compensate them for their time, what would be a motivating but also functional honorarium for folks. And we were able to connect with Success, as well as another organization, the Sikh Health Foundation, who work with Punjabi-speaking Sikh community. And we were very fortunate that despite reaching out to them during a very busy time when they were definitely working overtime to meet their clients' needs, that they were willing to partner with us. And I can say more later about how we made that connection. A really big benefit for us was that we got a huge response from interested participants. So they really knew how we could connect with people who would be willing to speak with us for an interview. Our inbox was flooded, and we were able to conduct quite a high volume of interviews quickly, early in that timeline of the vaccine rollout, which was really important. We wanted to be able to understand what was going on, see where needs were potentially not being met, and be able to share that feedback with health authorities while the vaccine campaign was underway. So it was kind of a race against time. We do have a couple of analyses that are coming out of this. One, which we're excited to share very soon, really focuses on community engagement in a general sense. So community engagement with Asian populations in BC and what it means to take a culture-centered approach to meeting people where they are. So that should be out in the next couple months, and we're excited to share. But I guess generally, I think this experience of working more closely with community organizations was new, at least to me as a researcher, and quite a bit of a learning experience. We did do interviews in Cantonese, Mandarin, and Punjabi, and so that meant all of our study materials were translated as well. You can see here in this image that we're sharing that this was also the case for our health authorities, one of whom I believe they were translating the most essential information into up to 27 languages. So here we have Chinese, Punjabi, and I believe Farsi all on the sign. And so it really was helpful to work with Success and understand what those language needs were. And yeah, I'm quite excited to talk more about all the benefits of working with community, and excited to hear more about Sarai and Jacky's experiences with that. Thanks.
Thanks, Wendy, for sharing your experiences. So we've got just under 30 minutes or so left. So we've got a few, as I mentioned, a few questions for the panel that I'm going to pose to start off with. But please do put your questions into the Q&A, and we'll get through as many of them as possible as well. So I'm going to start off just picking up on the last point you made there, Wendy, for a question for both you and Sarai on how you feel working with community partners has strengthened your vaccine research. So Wendy, maybe you can go first to sort of pick up from where you were just speaking.
Sure. Thanks, Manish. So the benefit for us was, I think, despite having diversity on our team, we were not, we don't work directly with community on a day-to-day basis, so we weren't all that in touch with the needs of the community. So reaching out early, sort of sharing our plain language summary of what we're planning to do. We also shared, I met with one of Jacky's colleagues and shared, the interview guide that we were planning to ask our participants, and she was able to give us some feedback on that and really help us fine tune the questions so that they would land a little better. We also plan to see if there was any data that they were interested in collecting that would be beneficial for Success themselves, just to hopefully make that data collection mutually beneficial. And that was really valuable because, often with qualitative research, you do a dry run and you find out your questions are not that great after you've asked them, and you have to fine tune those a little bit, maybe make an ethics amendment. So getting that feedback early in the process was fantastic. And I already touched on this, but we really just sailed through participant recruitment. Our inbox was absolutely on fire for a few weeks there in last summer. And that's normally one of the most challenging phases of qualitative research, finding someone willing to talk to you for an hour. So really helped us better share time and results.
Thanks. Sarai, do you want to share some of your experiences and how it's helped you?
Yeah, no, thank you for the opportunity to talk a little bit about just how important community partnerships can be in terms of being able to address our research goals. And certainly in the case of this project, trying to think about, so what could a change within the school-based delivery of the HPV vaccine in grade 6, what could that look like in terms of reaching out to those parents? And the nurses were so fundamental in terms of being able to come up with the approaches and being able to really help in terms of the protocol design that was going to be something that was actually going to work for them within their workflow, that would be feasible, as well as thinking towards the sustainability of it. So really thinking of this from a practice change perspective, and understanding that these are all, these are small steps. We kind of fine tune and tweak, try it out. Does that work? Did it improve? And then sort of moving forward and sort of evolving the intervention of a tailored messaging approach. But how did that actually look like within their own practice and their own program delivery? And so they were just absolutely instrumental in being able to guide that and ensuring that it was successful for them within that. And I think that was the key thing, was just being able to, as Wendy mentioned, getting that feedback to make sure that there was good alignment between their needs as well as the research goals as well.
Yeah, no, thanks. It sounds like it's really critical throughout the whole process, from getting the questions right, the recruitment, and then making sure at the end your answers are actually addressing questions of concern to the communities you're working with. Jacky, from your perspective, how has being a research partner impacted your work with success?
Yeah, I'm really grateful to have been of help in this research. I think for us, being a research partner really provides us with the knowledge about the subject matter, right, that is being researched. It helps informs us about, for example, what the latest trends would be, what are some gaps that we need to address, and also, things that we perhaps could incorporate in the current services. In the longer term, I think that also helps us with expanding our network with, just gathering different perspectives and perhaps inviting also our research partners into future advisory committees. And on the off chance, that would also help us with our next funding proposal for our projects. And then that is the case for us for right now, because we are now receiving PIAC funding for a COVID vaccine education awareness project. So yeah, and we're grateful that Wendy could share with us like a report with some of your preliminary findings. So we can learn about some things that you have heard, and that can help us refine, what we propose to do, when we submit our proposals.
That's great, Jacky. Thanks. And so clearly, there's an element of this that's about the project itself and things like maybe sharing the results sooner than otherwise, rather than having to wait for formal presentations and publications. So you can use the data, but also laying the groundwork for future projects like you've described. So just in terms of some of the logistics of this for people who want to try and make these sorts of connections and partnerships in their work, maybe Sarah and Wendy, you could talk a bit about how you established these partnerships. So when you did it, how you did it, and we're so used to in academic collaborations dealing with formal agreements, etc. So whether there was a formal memorandum of understanding or some sort of agreement, or whether it was more informal than that. So Sarah, why don't you go first this time?
Yeah, no, that's great. So I think for our project, it really sort of sprung out of existing networks for PIs and our public health partners who had worked together on past projects, and who really brainstorming around this issue of how do we break through this 70% coverage ceiling, and what are some of the things that we could start trying out. And so that sort of happened really organically, but being able to pull together and really start just a conversation. And one of the key pieces was actually a CIHR Catalyst grant announcement around this topic. And so that really sort of pulled together the team quickly to be able to start talking about sort of some concrete research goals and what that would look like. And so that was really helpful in terms of connecting with our community partners at that time. In terms of it was formal agreements, we did not have a formal agreement, but I think through the process of grant writing, being able to have that as a very collaborative experience, so that all of the goals were agreed upon for both sides of the partnership, as well as when funding was secured, ensuring that our community partners had autonomy over some of that funding in terms of actually being able to do the implementation. So that was also really important in terms of that sort of positive collaboration. I don't know. Wendy, would you like to add to your experience on how that partnership came about for you?
Sure, thanks, Sarai. In our case, it was a little different. It was a new partnership, so we really just began looking to see who was providing services to the communities we were interested in talking to, and just sort of Googling around, seeing what was in the press about these organizations, and we reached out to a few different folks. And I think what was really impressive about the work that Success is doing is just not only the scope of services that they provide. I think I'm still learning about all of the services that Success provides, but also that they had quite a lot of capacity to engage with research, and that seems to be a big priority for them, a part of the work that they do. So we were really aimed at identifying kind of shared goals with an organization, and I was just sort of cold emailing people. I definitely ended up speaking to some folks who were doing really amazing work, but just weren't quite so well established as Success, and were maybe shouldering, just one or two people were shouldering all of this work of providing services, and so definitely didn't really have the capacity to take on the needs of a research project. I had the pleasure of meeting with Jacky's colleague Amy, who I think I mentioned, who gave us just really excellent suggestions, and who seemed interested in the work that we were planning to do, and had really valuable feedback. We did not have a formal memorandum of understanding, but I think we came to it in the spirit of being quite open about what our needs were going to be and what we were trying to accomplish, and really aiming to find a way that we could work together that would be beneficial for both. But yeah, I definitely see the value of doing a formal memorandum, especially if the partnership is new and you want to make sure that you can identify shared goals. I think the spirit of that is really valuable.
Thanks. And Jacky, from your side, when you're being approached or when you're going into consideration of a research partnership, what are the sort of things that you would consider from Success? So some potential things that you would see as facilitators, some things that you might see as challenges, opportunities, and what information do you want from researchers when they're approaching you about potential partnerships?
Yeah, for us, I think first of all is if there's an alignment with what the research project is and what our goals are, what our mission, if it aligns with our mission and our vision and the things that we do. Another one is capacity, right? Capacity with, depending on what the partnership is, right? It might need different levels of support from our staff. So we have to consider if we can support this project. And also, in terms of whether we can help reach out to the clients that, or the research participants that you'd like to engage. For us, we have probably two steps, I would say, when organizations come to us and say they want to they want us to be a research partner. One is we have a research and engagement committee that is chaired by one of our directors, and also have participation from various divisions of success. So they would look at more of the general information, right? And this part, I think you should be very transparent, and also letting us know as much as possible the details about your research. What are you working on? What kind of affiliations you have? What are your objectives? Who are you trying to reach out to, right? And then after this step, I think it goes to actually what I do. I take care of more of, the frontline work. I work with the staff to build connections. So at that point, it's really important to provide us information that's in plain language, that is easy for us to share and digest, because most of the time, our staff does this work because they see the benefit, and they do it on top of all the other work that they're already doing. So it's important that we can share this information quickly, and we can also understand, so we can tell people, okay, what this research is about. Yeah, it's really important to bring in like a EDI lens to the research, just to make sure, in terms of the languaging, the vocabulary, and the study, it's inclusive to people of different cultures. Yeah, I think for us, really, it's with how we can support it, if it aligns with what we do, and that we can easily share information about your study to the clients you work with.
That's really helpful, and so clearly highlighting the importance not only of the content of that information that you receive, so it's thorough, but also the language that's used, so it's easily accessible to whoever the partner is. So it really needs to be well thought through and tailored to the partner. How do you think, Jacky, the research team were able to enable, in your case, to enable an authentic partnership?
Yeah, I believe Wendy started approaching us at an earlier stage in your research too, and have some time and space to review, the questions you would ask. So then, Amy could provide some recommendations. So I think coming in early and being open to, change, being, patient in explaining, what you want to do with us, is great, because we're members of the public and don't have the knowledge base to understand maybe some of the concepts. Yeah.
And given that sort of research is not the core activity for your group, how are you compensated for this sort of essentially additional work that you were doing?
I would say mostly, our staff are already working on different projects, and they're already funded by different sources. But what I would say is, something that maybe conversation for the participants would be important. So we can share and tell them about first it's beneficial for them to do it because the study helps them, right? Another part is, there are some incentives for them to take time to participate. If you were to talk about compensation in terms of, for our staff and organization, then I think you'd have to plan this very early, maybe for the next year or the years to come, because that's when, we have to consider our staffing and our financial resources.
Yeah, so clearly timeline is important as well. So maybe before we get into the audience Q&A part, if you could, I'll ask you all just to provide one piece of key advice as you see it for researchers or community partners who are interested in co-developing vaccine research. So Wendy, do you want to go first? What one thing would you say be your key thing?
I think the number one thing would be finding good overlap in your goals, and the number 1.5 thing would be just be very open to suggestion and to the possibility that you may need to change elements of your plan to align well with what the organization needs.
Thanks, Sarai.
So to add to that, I would also say any opportunity that you can find to make the community partnership their part of it as easy for them to do as possible is always so helpful. So once you have the alignment, everything, how can you help them, make that, input into research as seamless as possible.
Thanks. And then Jacky, what would be the sort of key thing from your perspective?
I think just providing information to us in plain language. I think that's very important.
That's great, thanks. So we've got a few questions already from the audience. So I'm going to sort of work through those, but if anyone else has anything else, please put them into the Q&A, and we'll, as I said, we'll get through as many as we can. So the first one's a really interesting one. It was asked initially during your talk, Sarai, but I think I'm going to open it to all of you because I think it's an interesting, I don't think I've heard it before. So what is your opinion on humor-based messaging to encourage vaccine uptake or culture-based messaging?
I'm happy to start. I think this is such an interesting conversation around different types of communication styles and where they touch people. And I think one of the things that I found quite interesting with this project and speaking to the nurses around their use of motivational interviewing as an approach was that each of them were able to use their own style of how they communicate with people. This is their profession in terms of being able to have those conversations, sometimes very tough conversations. And so they were all able to share sort of, do they use a little bit of humor? What sort of helps them be most at ease in those conversations? But I think this is really interesting around just trying different ways to reach people.
Yeah, and Wendy, Jacky, anything else you wanted to add to that? I
think I'm not an expert in humor-based messaging. I know that it's one strategy that's considered. I think what I would say is that that's definitely an instance where you need to talk to people who have the cultural and linguistic fluency, particularly if we're talking about linguistic or cultural barriers, because humor is kind of one of the last things that you perfect when you're learning a new language, right? So especially if you're as in the case of our study, you're trying to reach diverse audiences, you really want to make sure that you're working with people who understand how that's going to work, and that means having a diverse team and probably putting the messaging in their hands. We heard from our some of our participants who work in communication with health authorities, just how challenging it is to do translation well. It was something that we learned about the hard way. And that's one perk of working with an organization I forgot to mention, is they recommended a fantastic translation service. So that we continue to use on this study and others. So I would say tread lightly with humor-based messaging because it could go wrong, and focusing on what's going to be resonant in the right cultural register is really key.
Thanks. Jacky, anything else you wanted to add?
Yeah, I just want to echo what Wendy is saying. I think a lot of times, if you speak English as a second language, when you talk about, very important things such as your health, right? When there's humor involved, but you're not that fluent, that kind of catches you off guard. And, you're gonna think about, okay, is this like, you have to understand if, so the recipient may kind of misunderstand what you're trying to say. So I think that part's important.
Great, thanks. Sorry, there's a couple of questions specifically about motivational interviewing. I'm going to try and put all of them together. So there was a comment that 20% going on to get vaccinated doesn't seem very high, especially given that that technique is quite intensive and extensive. So how do you convince healthcare providers it's worthwhile? What are the main points of concern parents who do not provide consent to have after the motivational interviewing? And then how do you deal with different language issues that come up?
Yeah, no, thanks. So I think for the 20%, I think to recognize that this isn't, in vaccine hesitant parents, that this is a really challenging population in terms of changing those thoughts and that behavior towards acceptance. And so although 20% doesn't seem like a lot, I think that to really move that needle from that 70% coverage up towards that 90% target, it's not going to be a one solution that's going to jump us there, that we're going to have to layer on these different approaches. And so this might get us, a few more, and what other can we continue to add on to that? I agree. Motivational interviewing is incredibly intensive, particularly in terms of the training and that intentional practice. But I think this is the project I discussed was a really nice example of that. Motivational interviewing was already being introduced as part of their professional practice. So this was actually something that the nurses were doing as part of their own training, and we're going to be doing regardless. And so to be able to sort of get in with that and to give them another opportunity to use that training in a different way. So, now you can use this when you're talking to vaccine hesitant parents, that it actually was excellent alignment. And the nurses were really quite excited to be able to have another opportunity to practice motivational interviewing. So in terms of being able to get healthcare providers on board, I think for the motivational interviewing part, they need to be on board already, or it needs to be part of something that they're working at in terms of their communication approach to speaking about behavior change in general. In terms of the main points of concern that remained after those conversations, the concerns were those that we still continue to hear and certainly record when you look in the literature around a wanting to wait until a child is older, as well as concerns around safety. And there were questions from parents that they didn't feel that they had quite enough time from when the consents were sent out to being able to make that decision and when the consent required to be handed back in at school. So there was some good lessons in terms of what, if there was any changes, thinking about further tweaks to how the program is delivered around, can we provide more time for parents to make that decision, to ask those questions, to seek information that they are looking for. So yeah, that was sort of what remained after those conversations.
And then if you just very briefly, how do you deal with people who don't have English or French as a first language?
Yeah, and so I think that, speaking back, as both Wendy and Jacky pointed out, you need to have the right people having those conversations and using the right language and having it adapted to that. And so I think thinking about motivational interviewing, not necessarily in the words that it's using, but in the approach that it's taking, and that can be certainly adapted across different cultures as well.
Thanks. So we've heard from a number of studies, and I think was mentioned again today around how healthcare providers are the most trusted source of information, and particularly that's often family doctors that people are talking about, really built on the sort of historical traditional model where the family doctor would be the same person you'd go and see, would often look after the multiple people in the family. But with there being a real shortage of family doctors, had a lot of media attention in BC recently, particularly, and people going increasingly to walk-in clinics and urgent primary care centers. So how do you think that will impact trust in vaccines in the medium to long term? So Wendy, do you want to take that one first?
Sure, thanks. I think that's a really important question. That was certainly something we heard in our data, was really a lot of signals that access barriers were bigger than like just straight vaccine hesitancy. So I think that is something we need to consider, that this could have adverse effects on people's vaccine attitudes. I think what our study showed was that you really ideally need to have had positive experiences with the healthcare system in order to trust something like a vaccine that seems new and scary. The work that Success has been doing, as Jacky mentioned, with the webinars, where they would bring a trusted and well-known to the community healthcare provider who had fluency in the appropriate language, that was huge. And the community members that we interviewed often mentioned that was quite a big deal to be able to have that. I think that carries a lot of weight. And I think it's fantastic that they were doing that work on top of all the other important health education projects that they already do. I think that that's potentially a good solution for now. I know that they're continuing to do that for the vaccines for 5 to 11s, and that there's quite a lot of questions in the community still. And so reaching those who may not have a family doctor who speaks their language through that digital medium is really crucial. But yes, I think it does have a potentially negative impact to not have access to that doctor who sees you through the stages of life, like we wish we had.
Thanks. Jacky or Sarai, did you have any other additional thoughts on that issue? No. Okay, I'm going to squeeze in one final question before I wrap things up. So there's a question around how to better engage with a community for quantitative researchers. So a lot of what you've talked about is qualitative research. And as there's, again, traditionally sort of less direct participation from the community in quantitative research. So I don't know if anyone wants to address the issue of how quantitative researchers can do this better.
I can start. I think I think it's also reframing it as thinking of not necessarily, how from a quantitative perspective, if you have research questions that really are best answered in a quantitative methods, but ultimately someone's going to be using this information. And so can you approach those, knowledge users who really actually end up being knowledge experts as well? So I think that you can engage them right at the very beginning of your research and say, this is what we're thinking. These are our research goals. Are there people in the community that are going to be benefiting from this, and invite them in to provide consultation. But I think they also just strengthen what are those goals and what are the key things that you're going to be measuring? And then also, how are you going to analyze it that it's going to be useful for others? So I think at any point that, you can engage a community organization or just folks who are working in the community in your given field to be able to provide input, particularly in communities that don't often have an opportunity to engage in research. So in non-academic, non-urban centers, to be able to go and have that voice brought into your research can be really helpful.
Thanks. Jacky, did you want to add anything to that?
We get a lot of requests, from time to time, usually, and I think, maybe for community members that, you don't hear much about, and maybe they're not, maybe they're a bit marginalized, or, they have to spend a lot of time participating in, for example, your committee, then perhaps you should think about, compensating them for their time for it.
Yeah, thanks. And I guess it's really so about the topic of the research rather than the methodology that's going to be used in trying to identify the appropriate partners. So I just want to, we've got a couple of slides just to wrap up. I just want to thank Sarai, Wendy, and Jacky for taking your time and participating today, and all the people who attended and asked questions, and also all the people who've been working behind the scenes from CanCOVID and CAIRE to bring this all together. I just want to briefly put on your calendars an upcoming webinar this week on June the 9th on Protect Your Baby, Discourses and Perceptions of Vaccination and Pregnancy. That's being co-developed by CAIRE as well as CCFV, the Canadian Centre for Vaccinology, and CERN, the Canadian Immunization Research Network. And this is going to be delivered by Dr. Tara Manka from Dalhousie University. And so on the last slide, I just want to finally, on behalf of CanCOVID and CAIRE, thank everyone for attending today. Thank the speakers again for sharing their work with us. If you'd like to see a recording of today's event, you can visit the events page of CanCOVID's website, which is cancovid.ca, early next week, and it'll be posted there. And I'll draw the event to a close. So thank you all very much and enjoy the rest of your day. Thanks.